Ethan is 23 and has experienced psychotic episodes which were felt to be triggered by his cannabis use. He dropped out of university and his girlfriend ended their relationship, and it is these factors he blames for his condition rather than the drug taking. He is currently detained under section 3741 and is currently on a medium secure ward due to an incident of fire setting whilst experiencing a psychotic episode. Section 37 is a hospital order made by the courts at the point of sentencing, and section 41 places restrictions on decisions about leave that need to involve the Ministry of Justice. He has been unwell for several months, but his mental state is improving now, and he's responding to antipsychotic medication. He wants to go out very much, and aside from going into the ward garden, he hasn't left the ward for 3 months. The Ministry of Justice have just approved some short-term escorted leave, but the multidisciplinary team have been concerned about his risk of returning to drug taking. They do, however, acknowledge that he will need to try and go out of hospital at some stage, and that graduated leave is an important consideration in discharge planning.
Ethan is having his weekly multidisciplinary team meeting and his mother is there with him. The Ministry of Justice have authorized escorted leave, so we have discussed and acknowledged the progress Ethan has made, and we are giving him some escorted leave for half an hour a day to begin with.
The MOJ said I can leave the ward now, and I want to go on my own like other patients. But the doctors keep saying I have to be escorted. I don't know why. It's like they don't trust me. And it's not fair because I'm better now. I'm fine.
Although Ethan was a little disappointed to not have unescorted leave, we agreed that half an hour of escorted leave would be tried, then reviewed. If it goes well, it will be increased. Every time leave is considered, the nurse has discretion over whether it goes ahead, depending upon the risk assessment. A Section 17 leave form was completed, which we will review again next week, and Ethan signed it and was given a copy. Once escorted leave is successfully taking place, we can ask the Ministry of Justice to consider approving unescorted leave for Ethan. The nurse's report suggested that things have been going well for Ethan, and so we have increased his escorted leave to an hour in accordance with the parameters set out by the Ministry of Justice. Again, Ethan argued that he should be allowed unescorted leave like the other patients, and we explained that at the moment that wasn't what the Ministry of Justice was allowing, and he needs to continue with the escorted leave, and we will regularly review the situation to check how things are progressing.
Things are really frustrating in here. I hate it in here. Everything seems to take forever to sort out, and all I want to do is to be able to get my life back on track after this whole mess. The MOJ take forever to give permission for anything, and I'm just stuck in here rotting. I don't know how much longer I can hack it.
I had a one-to-one session with Ethan as I'm his primary nurse, and he told me that he hates being in a psychiatric hospital and is desperate for an ordinary life. It was concerning that he was tearful and appeared very low in mood. This is unusual for him. More worryingly, it appears he's been having thoughts of self-harm as he feels hopeless about his future. He's worried about the stigma of being detained under the Mental Health Act and what that will mean in the future in relation to getting a job or a girlfriend. I recorded this in Ethan's notes and told the staff during handover that he should not be taken out on his leave until his responsible clinician can review this situation further with him. I completed a risk assessment to reflect my view that he is at high risk of self-harm or suicide at the moment. This is not an uncommon pattern for patients who have been very ill. As they start to respond well to medication, they start to feel the full impact on their lives of what has happened to them.
I was meant to have some leave today, but the nurse on duty said I couldn't have it and didn't explain why. I feel so trapped in here.
Right, I have to have my leave. It's my right. The MOJ said I could have it. And the doctor agreed to increase it to an hour only yesterday.
Ethan, step away from the window. I've told you, you can't have your leave today.
The doctor said I could go on leave.
You can't have it.
You have to take me, I want my leave. How would you feel if you had to stay here for months on end? Nah, you wouldn't like it, would you? Bloody ignore me! I want my leave!
Ethan, stop it now. Step away.
my leave.
Go back to your room. Calm
Oh,
yourself
fuck
down.
off.
If you don't,
Fuck
you'll be
off.
getting nothing but
Cool
seclusion.
bitch.
Don't carry on at
Where's
this
your
rate.
fucking heart?
Just go. Just go.
Just go, yeah?
Calm yourself down.
Fucking knock you out,
Go.
fucking bitch.
I didn't know Ethan very well, as I'm not a permanent nurse on this ward. I saw he was agitated at the nursing office, so I went up to try and calm him down. Ethan explained that he was due to go on leave today for an hour, but the other nurse couldn't be bothered to take him. I knew the others were really busy, so I told Ethan I'd take him out.
What is wrong with this approach? Although the nurse is trying to be helpful and to calm Ethan down, it is at the expense of agreed protocol. Staff must be competent to accompany patients on leave. They must make informed decisions based on any risks they or others have identified, and whenever possible, they should have some therapeutic relationship with the patient.
Ethan, stop! Ethan, stop! Ethan!
So what should happen next? Ethan is at significant risk. He is in the custody of the hospital as a detained patient, and therefore the hospital staff owe him a duty of care. It was not a reasonable or proportionate decision that he should have been permitted to leave the ward after the risk assessment made by his primary nurse, who knows him well. There is now a real risk that he may try to harm himself.
Ella informed us immediately that Ethan had run off and was AWOL, absent without leave. So we called the police and informed them of the situation. We also had to inform the Minister of Justice, as Ethan is a restricted patient. The police were astounded that Ethan was taken off the grounds given the risk assessment. We gave them a description of Ethan and a recent photo.
We received Ethan's description and photograph and the place he was last seen. Fortunately, we found him safe, although distressed and crying, on Latimer Road. Ethan agreed to sit in the police car with us, and we talked with him, calming him down, until we eventually took him back to the hospital using powers to convey a detained patient who is able under Section 18 of the Mental Health Act. It's important that patients like Ethan are reported to us immediately, as they are subject to restrictions under Part 3 of the Mental Health Act. There is no discretion for these patients about when the police become involved.
Ethan was eventually brought back to hospital safely by the police, but the consequences of his AWOL episode are that his leave will be withdrawn pending further review, and staff will be far more cautious in the future about granting him leave.
I was meant to have some leave today, but the nurse on duty said I couldn't have it and didn't explain why. I feel so trapped in here.
I have to have my leave. It's my right. The MOJ said I could have it and the doctor agreed to increase it to an hour only yesterday.
Yeah. Ethan, go to your room. Gloria's going to come in a moment and explain to you. You can't have it today, but we'll tell you exactly why and what's going to happen. So if you give us 5 minutes, I'll get Gloria to come and see you. 5 minutes.
5 minutes.
All right?
Ethan was obviously distressed and agitated about not being allowed out on leave when it had been agreed the previous day, so I sat with him in the patient's lounge and explained why we were concerned about him at the moment. I told him that although I understood his frustrations, it was most important that we keep him safe. Ethan accepted that he feels very low at present and could understand why the decision was made, although he didn't like it. He enjoys drawing, so we set him up with a pad and some pencils. With his permission, I asked his mum to come and visit, which also helped him. I told him he can go on leave again soon when he's feeling more settled.
As Ethan is on a secure ward, there is a statutory notification process for all AWOL patients to the Care Quality Commission. This is no longer the case for AWOL patients in non-secure settings. In addition to alerting the Ministry of Justice that Ethan is AWOL, they have to be notified again on his return.
Well, I did go AWOL once.
Can you just tell us a bit about how that happened? Were you out on leave at the time?
I was out on leave and I was escorted, and I didn't want to go back to the ward. I don't know why, and I started running away, and then I hid behind a tree, but the tree was smaller than me, so they saw me.
It's been extended for me. I've been given, say, 3 hours leave. I've been at home at my parents' place with my parents, and they've sort of rung up saying, well, we'll drop him off sort of just before it's sort of time to have your medication and sort of lights out sort of thing. So they've willingly extended it.
I have been AWOL on several occasions. There was one time when I was I was actually in my pyjamas and my slippers, and I followed a cleaner out of the door, and she asked me, she said, "Are you allowed out?" And I said, "Oh yes, I'm allowed out." And so I just followed her out the door and sort of left, and I think I must have come home.
Because your home was so near the hospital?
Because my home was so near the hospital that I could just nip home and sort of get changed, but I actually didn't bother me being in my pyjamas in my area.
And what happened? What did the hospital do when they discovered you were missing? Do you know?
They got the police, and the police came and picked me up and brought me back. But it's more opportunist, really, when I sort of go AWOL. I don't really plan it. Not very often. I have done in the past, but normally it's if an opportunity arises and the door is open and I'm next to the door, then it's an opportunity to leave. I don't sort of think why I'm going or where I'm going. I just think I want to get out of here.